Welcome back to Open Line tonight. I'm here with Dr. Abramson from Vanderbilt. She's a medical oncologist, and we're talking breast cancer tonight. I know it can be a very scary topic if it has touched your family. There is a reason to be scared, but a lot of hope too now with where the treatment is going. And let's talk about that. Where are we and where are we going with treatment and the cure?
The cure. We are getting closer and closer, and I honestly couldn't do my job if I didn't think so. I really, really say that with all my heart. We started out not 50, 60 years ago, not really understanding this disease. And now, as we've talked about, we've really divided it up. If you look at a pie, I mean, the pie is cut up.
Sure.
And what we are really focusing on is sub-slicing it. So I talked about triple-negative breast cancer, but even within estrogen receptor-positive breast cancer or HER2-positive breast cancer, why is it that not all of these subtypes are cured with the treatments that we have? These cancer cells become resistant. They're like, I always liken them to bacteria. They find a way to develop resistance to the antibiotic, right? It's the same concept here. And what we're trying to do now is to figure out what's causing the resistance and what can we do to target that resistance. And when should we do it? Should we do it early? Should we do it very early when the person's first diagnosed? How should this all work out? So what we've been doing a bit is within estrogen receptor positive breast cancer, we have a bunch of new drugs that are out there now that target different pathways in the cancer. And we're finding that when we look at metastatic disease or disease that's already spread, one new drug has doubled the time that a person can live without the cancer growing.
Wow.
So it's gone from 10 months to 20 months if you're taking this pill, which really doesn't have a lot of side effects either.
Which is great.
It's amazing.
Yeah.
It really is amazing. So we've been focused on trying to figure out more and more little areas that we can target and break down that overall breast cancer into tinier and tinier slices.
You've told us over the past hour about all the advancements happening. How hard is that to stay on top of?
Well, it's what I do. It's what I do, and I enjoy it. So, but it is hard. I mean, every single day there is something else that's coming out, some new area of research. Of course, in terms of drugs that are actually approved, it's usually about, these days it's been remarkably about one a year, which is amazing. And so now with a patient, it's not just, oh, you have breast cancer, you're going to do this, this, and this. It's, you have breast cancer, let's figure out a specific treatment plan for you. Exactly. That's exactly right. And the focus is less and less on what particular stage, unless it's stage 4. Stage 1 or stage 2 or stage 3. Well, it's really more about what is the type of cancer. Because a stage 1 of one type could be more aggressive than a stage 2 of another type.
Yeah.
So we have to look at all of those different characteristics.
Interesting. Okay, Marilyn's on the line. Want to make sure we get your question answered. Marilyn, thank you for calling in. What is your question?
Yes, I've had what's called atypical cells, and I'm a little bit confused about it, but it ended up being okay. I had a mammogram scare, I had a biopsy. Then I found out it wasn't cancer. I was told it was not cancer, but they were atypical cells. Well, the breast doctor wanted to go ahead, and I had to have an MRI done to, I guess, so they could see something about it. But then I went ahead and I had surgery, and I guess she took out those atypical cells and then, around them also. But ever since that happened, and that was in 2012, I just live in constant paralyzing fear that something's going to happen to me. My mother is a breast cancer survivor of like 20 years or more. And they say, and I do have the dense breast, just like you said, but I'm always so scared. And I get my mammograms. I also have an MRI done. And I'm just scared. But I don't really understand what it is. And I'm glad they were proactive about it and did what they did. I just keep thinking I'm going to get it.
Yeah.
I keep thinking I need to get tested more often, or something's wrong. Why do I just wait a year?
Marilyn, I'm going to cut you off because
me now. Anyway.
We're running short on time, and I want to make sure we get your question answered because I can hear the fear in your voice. What is this that she's dealing with?
Absolutely, and it is a scary situation. So atypical cells, there's atypical ductal hyperplasia, atypical lobular hyperplasia. These are basically precancerous cells, and the reason they did the surgery is just to make sure that there wasn't an area of actual cancer in there, just to make sure. And that's very reassuring that there isn't. Somebody who's had a history of atypical cells does have a slightly increased risk of developing a breast cancer. So that risk is there, but the risk is not very great. It's not like having a BRCA mutation. It's not like any of that. Your risk of developing a breast cancer is slightly higher than that of the general population. And getting MRI screening and mammography, that's exactly what you need to do. You're doing the right thing. And know that if you're doing these things, that if something does develop, it will be found, and continue doing breast exams.
And she mentioned that she has the dense breast. What was that scan that you talked about that may be beneficial?
Tomosynthesis.
Tomosynthesis.
Yes, for mammography, and then the MRI would be great for that as well.
So she's doing the right thing, and she should take confidence in that.
Absolutely.
Okay, Marilyn, I am so glad you called in and asked that question, and I hope that puts your mind at ease. This is a scary disease, and I'm sure you encounter that every day in your practice. What do you tell your patients?
That's tough, and it really depends on where they are. But for the survivors, for the people who've dealt with this, and here they are 5 years later, there has to be a little sense, there has to be that trust, and it takes time. There are so many patients who come in, and I understand this, who think that every little thing is cancer.
Sure.
And how could they not? How could they not think every little pain is cancer? But it's a matter of moving past that and sort of saying, well, I could also get into a car, and the same thing could happen. And knowing that there are great treatments, and I also want to address metastatic disease in that sense too, because there are people who are surviving with metastatic disease, and they need to remember that we're focused on curing this and making this a chronic disease rather than just another disease.
Yeah. Okay, we're going to take another quick break. We will be right back. Thank you for all of your calls tonight. Stay with us.